Assalamualaikum and a good day again. In this session, we're going to be drawing the arterial supply of the stomach seen from the anterior view. Okay, we're going to start right now. Bismillahirrahmanirrahim. In the name of Allah, most kind and most merciful. As for the basic structure of stomach, just follow me. Okay. Here. Then this one. Right, nice. Next is we have the abdominal aorta. Then, okay, alright. The arteries that supply the stomach mainly arises from the celiac artery. No, in fact, all of them arises from the celiac artery. Okay, for the celiac artery, since it's the anterior branch, we're just going to be drawing it like this. Okay, the celiac artery have three branches. The first one, the smallest branch, the left gastric artery, it goes up. Then as it reaches this part here, the esophagus, winds, stops here. Okay, the next branch, the largest branch of the celiac artery, is the splenic artery. It goes to the back of the stomach, runs tortuously on the upper border of the pancreas, and then emerges here, where it gives off a branch going up, supplying the fundus of the stomach, and a branch going down, which supplies the greater curvature of the stomach. Okay, next is we have the mid-sized branch from the celiac artery, which is the common hepatic artery. Goes here, and then at this point here near the duodenum, it branches off into the gastroduodenal artery, goes behind the duodenum, and then goes downward. This part here, again, it branches into two, which is this one we call the right gastroomental artery. I'll label all of them later. Then also runs along the greater curvature of the stomach. Okay, alright. What else? Oh yeah, one more branch, which is this one. This part here is called the common hepatic artery, and this part where it bifurcates, this part is called the hepatic artery proper. And from the hepatic artery proper, we have a small branch. Okay. To make sure that I'm showing that it doesn't have any connection with the arteries, I'll do a little bit of a jumping for the drawing. Then runs along the lesser curvature of the stomach. Okay, so it's like this. Add more for the greater curvature. So I'll just add a little bit more details here. Okay, alright. I'll now proceed to the labeling. First, I'll just label the important arteries which supply the stomach, which is, okay, this one is the source, branch, the first artery, and then this one, next is this one, and then the last one is this one. Okay, so the first one is the abdominal aorta. Next is the celiac artery, or in some book they use the term celiac trunk. This one is the left gastric artery. Oh no, this one is the right gastric artery. This one is the left gastric artery. This one is the short gastric artery. Next is the left gastro-omental artery, or in some book they use the term left gastroepiploic artery. Last one is the right gastro-omental artery. Okay, as for the arteries that supply the stomach are these 5. First one, second one, third one, fourth one, fifth one. As you can see here, all of the arteries originates from the celiac artery, which is the anterior branch of the abdominal aorta, starting from the level T12. Okay, just to add a little bit more, okay, this is actually quite complete diagram of the arterial supply of the stomach. From now on, I'll just gonna be adding extra information which will help in understanding all the other branches of the celiac artery. Okay, proceed with the labeling again. This one, which is the splenic artery. Oh, forgot. Actually have a bit branch here. This runs. The splenic artery runs on the upper border of the pancreas. So one more branch. We have the pancreatic artery, or pancreatic branch. Next is we have this one, the superior pancreatico-duodenal artery. Next is this one. We have the common hepatic artery, which is the artery before it divides into the this one, gastroduodenal artery, and this one, the hepatic artery proper, or in some book they use the term proper hepatic artery. Then next is this one, the left hepatic artery, which supplies the left lobe of the liver. This one, the right hepatic artery, which supplies the right lobe of the liver, and the right hepatic artery gives off a small branch, which is the cystic artery, which supplies the gallbladder. Okay, as a recap, celiac artery have 3 branches. First branch is the left gastric artery. Second branch is the splenic artery, this one, and splenic artery has 3 branches, which is the pancreatic artery, the short gastric artery, and the left gastro-omental artery. The last branch of the celiac artery is the common hepatic artery, which bifurcates into the gastroduodenal artery and the hepatic artery proper. Gastroduodenal artery runs behind the first part of duodenum, and then as it reaches downward, it bifurcates into the superior pancreatico-duodenal artery and right gastro-omental artery. Okay, the hepatic artery proper gives off a small branch, which is the right gastric artery, also supplying the stomach, and then it goes upwards, bifurcates into the left hepatic artery and right hepatic artery to supply the respective lobes of the liver. The right hepatic artery has a small branch, which is the cystic artery, which supplies the gallbladder. So that's it. Remember, there's only 5 branches which supplies the stomach, which is these 5 circled ones right here. I think that's it. Thank you and Jazakallah khair for watching the video.